I love being able to circle back with companies on products and projects that we've spoken about before. It's a rare chance to see how much progress has or hasn't been made and to hear about the lessons learned. A year ago at eHealth 24 in Vancouver, the team at MEDITECH shared information about their new Traverse initiative for Canada and how it was going to make it easier for MEDITECH customers to access health information from a variety of different sources like PointClickCare and provincial health repositories. Now, while I was here at eHealth 25 in Toronto, I caught up with MEDITECH and was pleasantly surprised to see how much progress they have made. It's a lot, by the way, and how they are expanding their initiative. Let's get to it. Well, Allie, Rob, welcome to the program.
Yeah, thanks for having us.
Good morning. Nice to see you again, Colin.
It's been a while, bit of a year, I think, since we've had you on camera, but I'm excited because we're here at the eHealth 2025 conference and we're going to talk about Traverse. But before we get there, Allie, maybe you can tell us a little bit about your role at MEDITECH and a little bit about MEDITECH.
Yeah, sure. So I'm Allie Anderson, Senior Regulatory Program Manager for Canada. I'm really in charge of, monitoring the Canadian landscape, the regulations that come out to make sure our software is meeting those requirements and we're, up to speed with what's going on. And I've had a big role in Traverse Exchange Canada with project managing and working with the vendors that we've connected and Project Amplify. So yeah, it's exciting stuff.
And MEDITECH's been in Canada for a while. You've been a large EHR vendor to a lot of the hospitals up here in Canada and Ontario.
Our network right now is it's just in Ontario. We've connected all of our Ontario MEDITECH sites. So it's really exciting. We have other customers across Canada as well.
Now, Bob, a year ago, we spoke about Traverse Exchange. And at that point, it was a lot of connecting fellow MEDITECH customers with folks like PointClickCare and bringing in some of that data. But since that year, you guys have done a lot of work.
You have a great memory. Yes, it was eHealth, and we spoke about a year ago. At that time, we were really excited about connecting our MEDITECH to MEDITECH and exchanging the documents. Patient summaries on our network. As Allie has indicated, we've expanded. I think we have 43 MEDITECH hospitals now on the network, 11 instances, really exciting. But in addition to our MEDITECH exchange, there's been a great deal of collaboration with the other vendors. The Oracle eHub, and they're representing 60 hospitals. They're exchanging with us and us with them. It's a bi-directional exchange. And we're onboarding some Epic instances. We should probably have another 10 Epic instances connected on our network. Again, bi-directional exchange. And that will happen probably over the next 6 to 8 weeks. So we are excited. And it has come a long way in just the course of a year. So pretty good stuff.
So did I just hear that right, that you're working with Oracle Health and with Epic to exchange data up here in Canada?
Loud and clear. I find the vendor community is really in a cooperative mode, if you will. I think all of us have the best interests of our constituents, the Canadian population in mind. And I think there's a relevance of exchanging patient data for the virtues of doing so. The savings, the safety. I think we're trying to help in the workforce challenge and anything we can do to help. And I mean that not only from the MEDITECH perspective, but again, the community of vendors, we're leaning in, and interoperability has been, I'll say, supported from the InfoWay leadership all the way through the provincial leadership. But now it's time to really, in the vendor community, advance it. And it has moved. Yeah, the needle is there. We're moving this needle.
Well, I'm going to chalk that up to us sharing maple syrup up here. And there's something we must have put in the maple syrup to
maybe so.
The
good
collaboration,
sweet stuff.
Sweet stuff. But also the fact that we have a single patient ID, it kind of helps to be able to
You're right. That
exchange
Canadian
data.
health insurance number identifier is good for us to make sure we're exchanging the right data, and everybody's trying to be sensitive. All of this as a network, maybe not as evident last year, but as we mature this, it is a Canadian network. It is all the data resides in Canada. We might refer to it as a federated network where we're exchanging, but each of the source institutions have that record, but we can exchange it and pass it through. So it's been very positive.
Well, Allie, Walk me through how someone from MEDITECH will access the information that you've collected through Traverse Exchange.
Yeah, so regardless of where they go in the healthcare ecosystem, if they're connected to Traverse Exchange Canada, the MEDITECH clinicians are able to pull up that data for that patient. So it's really exciting. So we can now launch Traverse Exchange right from the patient's chart. And we can do that by, selecting the Traverse Exchange button in the toolbar, and it launches to our new patient consolidated summary viewer. And with that, the clinicians can now, filter all of the data elements. And what we've heard is, with all of this data exchange across the network and all of these new connections coming on, it's really an overwhelming amount of data that they're now getting, right? And it could be multiple documents that they're getting for each patient. So it's really important that they have a way to search through that, find the data that's actually pertinent to them, deduplicate data too. So this new solution is going to deduplicate data. It's going to consolidate all of the data into one patient summary document, which is what they're looking for. And that even helps on the storage side too. So when they're pulling in that documentation, it's just that one consolidated document, whether that patient has gone to multiple facilities, we're consolidating it into one document so they can have it stored.
Just to be clear, when you say deduplicate, that might be like the same visit to another organization. I might get that record twice. You guys will be filtering all that out.
Yeah, and also the data elements. So like the PAMI data elements, the problems, allergies, medications, immunizations, right?
Gotcha.
If those are coming in on multiple documents and it's the same thing across the board, we're going to deduplicate that and just show it once.
We're leveraging that structured document to access, we'll say, nomenclature or terminology behind the medication terms, so that we know that this is, if metformin was listed from two different sources, we can list it once because we can unify that presentation. And that would be a deduplication example.
Yeah, and so let me just show you some examples here of being able to search through. So for example, you can see all of these different widgets here. You can customize this however you like for this specific user. And then if you want to, let's just say, pull up a specific encounter, maybe it's an emergency visit that the patient had, you can actually type in here and pull that visit up, search for it, and then find the information that's pertinent to that specific visit. So here's just an example of that.
So in this example you're showing here, it's about an emergency visit that I'm searching for.
Yeah.
I just search for it, and now I can bring up that one encounter.
Exactly. And then maybe you're just looking for a specific lab test result that was done on a patient. You don't want to filter through, sift through all of those lab tests. Well, now you're able to just search and find it. So click on the lab widget and the search field there and pull it up what you're looking for.
With interoperability, there's a bit of a cognitive load that we're putting upon the providers. So this tool is really helping to lessen that burden and try to identify ways to search for that data, specific elements, but present it in a tiled manner so that people can say, oh, now I understand I didn't have to go through many documents to review all the sub-elements of those documents.
So in terms of the impact on the clinicians, what is it that you're hoping with the Traverse data will allow them to do that maybe it's difficult for them to do today?
I think there's a couple of things. The patients are going to benefit. They don't have to tell their story twice. It's going to be there because it's presented and we've exchanged the document. Regardless of where they visited, we can exchange those documents. Now that we have the documents and the data presented, I think that burden of a provider having to research or review, let's say it's a 100-page document, maybe it was a post-operative summary that was exchanged. Well, that's wonderful that it could be exchanged, but to actually extract those salient elements that have to be presented. What are the meds that the patient's been on since that surgery event? So I think we're saving time. In the end, there is a time savings, but there's a patient, I'll say, maybe improvement of the experience, because I can arrive and Dr. Allie will have all my information at her fingertips, regardless of where I last had care provided in Ontario, which is a really big win.
And Allie, what are some of the provincial assets that you guys are bringing in too? Because it's not just the Oracle data or the other EHR data. You brought in some stuff from the province as well.
Yeah, so we've already connected to the drug repository, the DHDR, and also OLIS, the lab repository. And right now we're working on connecting the PHSD, which is the Provincial Health Service Directory, and also the PCCG, which is the Provincial Care Coordination Gateway. So that has to do with e-referrals and provider information and bringing that up-to-date information into the MEDITECH software.
Right. So now you're bringing in all these assets into one place to
Yeah.
allow people to access it.
Absolutely.
Is there anything that had to be done to that data to get it into MEDITECH Expanse, or was it just as simple as flipping a switch?
So there's specifications for each of these interfaces that we're onboarding and connecting to. So, working with Ontario Health closely and being able to meet those specifications. And once we do that, we're able to seamlessly onboard our customers. And the network really helps with that, right? So there's a lot of administrative work that goes behind the scenes, a lot of privacy impact assessments, threat risk assessments, technical vulnerability assessments that go into it. So having a network actually allows us to do all of that once and covers everybody that's a MEDITECH organization on our network, rather than doing it per individual organization, which is how it used to be done.
Right. And
we're piloting that. The approach is to pilot this and review all those details, speak with the Ontario Health representatives, make sure we've got it done in a way that we can then rapidly deploy it to the other hospitals that are on the network. One endpoint used multiple times.
And what's the early reaction been to this capability from some of your pilot customers?
Very exciting because it lessens the burden on them as well. So it's taken off, and I think everyone's really excited to start onboarding all of these connections.
I think the value of having our providers in particular, but our nursing teams, just staying in our Expanse solution and have at their fingertips from within Expanse without having to launch another, say, an OLIS viewer or another provincial asset launch. It can all be served up within our solution, that's winning some hearts right now.
If I can ask, what's next for Traverse, or what's next for Expanse up here in Canada? What else can we expect?
I think you're going to see more provincial asset connectivity. We're already looking to move west with this connection. I think we're at the beginning of leveraging this network. Maybe a year ago, we had described it as laying out the cable for internet or TV. And now that we have this infrastructure in place, I see more great things coming. We can link things together. There's efficiencies with those connections in particular that we can leverage them for multiple organizations. I think more is to come. And maybe in another year we could chat about that. But I am excited having this in place. Things are moving well.
And Allie, final question, where can people go to learn more about MEDITECH, about MEDITECH Expanse and Traverse?
Yeah, so meditech.com has all of our information on there, so you can go on there. Specifically, there's the Canadian page, so we list all of our Traverse Exchange Canada information on there, any best practices, documentation. So we also have a bulletin board too that everyone can subscribe to and get updates. So yeah, definitely join us on meditech.com.
Well, Allie, Rob, thank you so much for joining me on camera today. It's been great having you, and thanks for the little tour of Traverse.
What a pleasure. Thanks, Colin.
Yeah, thank you.
I want to thank Allie and Rob for being willing to join me on camera to talk about everything they have accomplished with MEDITECH's Traverse platform in Canada. I'm really encouraged about the progress they have made with bringing in information from competitors like Oracle Health, Epic, and all of those provincial databases they mentioned. It's not easy to get all of those parts of the ecosystem working together. Interoperability is so needed in Canada, so it's really nice to see everyone working together to actually make it happen. I'm Colin Hung. Thanks for watching, and I'll catch you on the next episode.